Hello, friends. Welcome to your weekly motivational moments with Eric Vickery, president of coaching at All Star Dental Academy. With me is my fellow coach, my friend, Shyanne. Hi, Shyanne. How are you?
Good, Eric. How are you?
I'm doing good. Doing good. Uh, it's great to have you here with me. We're going to do a weekly just coaching session for those that are listening this weekly at their huddles. So, what would you say is really important for you to be working with your clients on right now? What's number one?
Right now, I would say all things filling the schedule. So, whether that's
Mhm.
case acceptance or
Yeah.
recare recall, really is what my focus has been with clients.
All right. Filling the schedule. So, just warm bodies, anything will go. A bunch of deliveries and adjustments, right?
No. Butts and seats
No.
are good, but no.
Yes, butts and seats are good. All right, so what would you say is the coaching hack then that this week we really should be emphasizing and working on to keep butts and seats and having that schedule full to goal? What would you say?
Right now, I'm working on case acceptance. So, the three yes system is what I like to think. So, 95.5 case acceptance formula, right, Eric?
Hmm.
You
Hmm.
love this concept, and I've been
Yeah.
working with all of my clients on it right now too. I have an office who's really trying to get their Invisalign cases out there. They're
Hmm.
pushing for that right now. So
Hmm.
we're working on that
That's good.
95.5 principle, really focusing on what is the condition and
Mm,
helping patients understand that condition. Because the concept or the principle here is that people don't buy a solution to a problem they don't perceive to have. So, this is why
yes.
admin, you hear things like, hey, this tooth isn't bothering me, so I'm going to go ahead and wait
That's right.
or cancel, right?
Yeah. So I have a question for you. So with Invisalign, butts and seats, and
Mhm.
you mentioned 95.5 rule, I think it's a really cool topic, and we'll be direct with this, but I've got I don't know, crowding in my teeth, and Invisalign. I'm an adult, and Invisalign is going to be the proposed solution, but the problem is crowding of teeth. Well,
Mm.
the next part of that we also have to address in this process is consequences, whether it's Invisalign, missing teeth, uh, you know, uh, decay, whatever it is, there's always got to be a consequence to not doing something. So with Invisalign and straightening teeth, just curious, what are you hearing offices talk about when they talk about consequences here?
Yeah, so they're talking about that overcrowding, that
Hmm.
misalignment,
Hmm.
even jaw pain. So,
Yeah.
peace of mind knowing that they're not going to have any jaw pain, food traps, things of that nature.
Yeah, I would think higher decay rate. I would even
Mhm.
think like, always talk about knuckles, how they hit together, that malalignment, just bad teeth alignment, I guess is the right phrase for it, and what's going to happen down the line with breaking teeth. And so you got to let your patient know, hey, this is why we're concerned about this. The crowding is here, the misalignment is here, and this is what's going to happen if you don't do anything. And then ask them. You talked about three yeses. So what are the asks then?
Yes. So we did the 95%, right? You've done
Hmm.
many motivational moments on that 95-5 rule, which I absolutely love.
Hmm.
So 95% of the time, we're talking about the condition. Before we're moving on, we're assessing how concerned is the patient. So we ask the question, how concerned are you with what we've discovered today? Okay.
Hmm.
If they say all in, yes, I'm concerned, would it make sense then to talk about a plan? So that's our
Okay.
yes number two.
Okay.
If they say yes to those two, then we have permission to move on to that 5%, discussing the solution. How do you feel about moving forward with this plan? Our third yes. We're getting that commitment from the patient who understands those conditions and consequences.
Yeah. And those are two of those are not yes or no questions. I'll point that out. They are how questions. They're open ended. They're getting the
Open ended.
dialogue going so people don't yes you to death. So this week, thank you, Cheyenne. I really appreciate it. I love it. So this week, let's focus on this. How concerned are you with condition? Would it make sense to talk about a plan? Talk about the plan when they say yes, and then say, how do you feel about this plan? How do you feel about moving forward with this plan? How much sense would it make to move forward with this plan? Use your how questions there, and also focus on the consequences in that 95 part of the 95.5. Does that sound about right?
That sounds right. Love it.
Awesome. Love it. Go out and make it a great week, guys.